And now it is my great pleasure to introduce our second keynote speaker, Pilar Caceres, who will present instant PIP and the PPE crisis during the COVID-19 pandemic. Pilar is the director of the National Center of Protection Means in Seville, dependent of the INSST. She's been involved in standardization, testing, certification, selection and use of PPE for assistance. She's also the president, among others, of the CTN 81/SC1, Spanish Subcommittee on PPE, member of the PPE Experts Working Group of the European Commission, and member of the Steering Committee and Working Group of Eurosnet. Welcome, Pilar.
Thank you, Mariana, for the introduction. And good morning, everybody, all of you. It's nice to see people again. And of course, everybody who is watching us through these computers. It is a great pleasure for me to be here on behalf of the Spanish National Institute of Health and Safety at Work. And of course, being with you after all this time without almost seeing people. I've been told to present today the activities that the Institute had to do due to the crisis of PPE because of the pandemic, and the activities that especially were done through its national center in Seville, CNMP. As you probably know, CNMP, apart from being part of the Institute, is also a notified body for the PPE regulation. So it has the appropriate facilities for testing personal protective equipment. And in fact, it has been dealing with verification of PPE since 1974. But today, I'm not going into a deep technical presentation, but I just would like to tell you a story. Just the story that we lived at CNMP during 2020. And I could speak for hours, but I don't have time, so I have decided to prepare an index with 9 chapters. Don't worry, they are short. And I have named them, as you can see, as the start point, declared crisis, blue bridge crack, tragedy, solidarity, on duty, numbers, CFC, and equipment use. I have highlighted those particular experiences we had, and I would like to share with you today. So everything started the 11th of March, when the world pandemic was declared. And the 14th of March, we have in Spain the declaration of the state of emergency, and we were all sent home to be confined. We were frightened. We didn't really know what meant the state of emergency because we never lived that before. But right that weekend, we started to get phone calls demanding specialized technical assistance on PPE from the Institute. And then the activity of the laboratories were declared as essential. So everybody had to be at home, but we could and we should go to work. I feel really proud to say that no one in the center, going from guards to administration and technical staff, gave a step backwards at any moment. Exactly the opposite. Everybody felt the need to put their knowledge and work at the service of the society at that moment. An important mayor of this country said those days that in war times, every day is Monday. And believe me that this sentence has been the reality of the lab people during months. For 4 to 5 months, there was no respect at all for weekends, holidays, family life, but for respiratory protectors, protective clothing, face shields, and gloves. And it is important to mention that at that time, as I say, everybody was confined. And also children were at home. And we have to move our offices to our houses without really being prepared for that. And everything that Cristina has mentioned, it happened. We organized ourselves as well as possible, but of course, we saw all these problems. And I know that shortage of PPE has affected all of us in a very similar way. And I'm not going into the details of what the problem was and how we dealt specifically with it. But you know it. But I would like to mention that it was very important at that time, cooperation and coordination. And we in Spain, I think that, of course, the beginning was a little bit hard, but I have to say that we coordinate between different departments, government departments, and we didn't do it that bad. Of course, everything could be improved, but it was okay. And also, I would like to mention that we in Europe also cooperate. And I feel very happy to say that I have some European colleagues, some of them are here today with us, that really were very supportive. They were there. We shared experiences. We shared concerns. And I would like to take the opportunity to say a big thank you, because it was important at that moment. It was a new hard situation with a lot of uncertainties. And I think that we more or less cope with it thanks to the knowledge and experience acquired during normal times. We have plenty of numbers about PPE tested and so on, all of us. But I would like to highlight today the human behavior behind the huge amount of work done. And to continue with the story, let's please flash back to 2019, where during the EuroSnet conference in Dresden, I presented what I call the blue bridge to user safety, trying to represent with this bridge the European system we have to guarantee the availability of safe PPE in the market, so to ensure protection of workers. And I think that this bridge gives us certainty. It's relaxing to have a system that guarantees that. But at that moment, we say that there was shortage of PPE. We needed PPE and we could not find them. So there was no option but to open the European market to third markets. And we allow PPE with non-CE mark to come into our market. And then, by doing so, the blue bridge went through a little earthquake and cracks began to show. The solid pillars of standardization, evaluation of conformity, coordination of notified bodies, and market surveillance were not functioning as usual, and therefore the user's safety could be compromised. So we all first tried to compare the standards coming from third countries to our European standards, just trying to understand how those non-CE mark PPE could protect our workers. And then, once the national legislation was adapted to the European recommendation, we still have to wait a little longer until some PPE arrived to our countries. And during those 4-6 weeks, we were receiving hundreds of questions. Hospital directors, managers, healthcare workers, preventionists, first responders were writing to us or phoning us with really heartbreaking demands. What should I do if I don't get PPE? We have to think that these people, these healthcare workers, were right at the front, scared with the situation, because it was really devastating what was going on. But they didn't stop their duty of looking after ill people. And they were asking, what should I do? Because PPE was an impossible mission, and they had just some amount of PPE in hospital they have to look after like gold. There was nothing we could do. It was frustrating. It was hard and tough. And I even have to admit that once I almost cried when my daughter stared at me and said, "Look, Mom, what are you doing? Working so hard, so many hours, and you can't even get one mask for all these people that really need them." So that was tough, because it was true. We couldn't get any PPE for anyone, and people were desperate. They were really struggling. And that word, for me, I don't know, but the sound at the when it's written, it sounds really strong when you are struggling for something. So we have no option but to develop a decision tree. A decision tree to help in hospital to establish a strategy and prioritization for the shortage of PPE. And we had to go so low as recommend the use of plastic aprons and reutilization of masks. You can only imagine how difficult it was for us doing something like this. We were proposing exactly the opposite to what we always say is correct. And it was like going against our most deep principles in terms of use of PPE, but there was no option. So, as I said, it was kind of an impossible mission to find PPE. And then we got the solidarity. And we got what we call the inventors. We had people coming from other fields, professionals, putting their experience and their knowledge at the, they put their knowledge and experience trying to provide PPE. Everybody, or many people thought that, if I'm designing or making filters for other applications, I would be able to make, to manufacture a mask, a respiratory protector, face shields, you can imagine. You look at it and you think it's something so simple. But I have to say that despite the big solidarity, effort, and interest to help, we had no succeed. Because, unfortunately, designing and manufacturing a PPE according to the European legislation and the harmonized standards we have in Europe is something that cannot be done over the night. Nevertheless, technical staff in the lab were patient, professional, testing and testing different prototypes, giving feedback, proposing solutions, but seeing and realizing how important, as notified body, is to have in front of you, on the other side, someone who really knows the meaning of essential health and safety requirements established in our legislation. So we saw that we need to have manufacturers of PPE in Europe. We cannot so highly depend on third countries, but it has to be with the full knowledge and complying with the spirit of our PPE regulation. And finally, thank God, we started receiving at least non-CE mark PPE, mainly masks. Sadly, we were covered by masks. Boxes and boxes, packages and packages with samples were arriving to our center. Health authorities were sending us all these samples and technical documentation. They wanted us to analyze the technical documentation and verify the PPE before distributing them to hospitals and everyone who needed them. We are talking about April, May, when scientific experts were not sure the way virus was transmitted, not being particularly considered airborne transmission, but surface contamination and contact. So, in our center, we were receiving boxes and boxes coming directly from China. Just imagine the fear people felt when handling all those boxes. They were disinfected straight away, and sometimes we had the risk to lose the sender information, as you can see in the picture. You may see it very ridiculous today, but please, cast your mind back to the way you were feeling and acting in your private life at that time. Lab people were going to work every single day. When most of the population was at home, we could not go out, but they were doing it every single day. They do not doubt at all about the duty, but it is understandable to think about the fear they felt, thinking about the possibility to take the beach back home and put their loved ones in danger. So they tested and tested, and there are not so many. Don't think that we are, a lot of people, but a few of them. And they kept testing and testing, verifying technical documentation, even in Chinese, until we reached the number of more than 1,000 different models, types of PPE tested. We are talking about models, so imagine, multiply the number of tested done. And also, we were attending all the technical assistance demands, reaching more than 6,000. And if you see the graph, most of the work was concentrated between the end of March and August, July, August. So it has to be done, all the work, in a very short period of time. And it was a huge amount of work. We received good products and not so good ones. But at that moment, time was crucial. We had to guarantee the protection of the workers, but it has to be on time, right now, because giving the result of a verification of a PPE 2 days later could be having no PPE in hospitals, and they needed it. Of course, we could not go through the whole process of evaluation of conformity with the regulation. We just decided to do critical tests. And at that moment, we had coordination of notified body developing a simplified procedure. We may criticize it. We are good at that, but I don't think it's fair. They did a good job, considering the situation, and it helped a lot to reject bad products. Of course, there are gaps, but we have to think about the moment where they did it, because that was important. And with these simplified methods, I think we saw how important is our blue bridge. You have this solid pillar, you have everything prepared to help you to comply with essential requirements that guarantee the protection of workers. And during all this procedure and all this testing and so, it was very important, the coordination in Europe. Very, very important. We all have to go in the same direction. And I have to say that I was very happy at those moments where I saw OSH coordination, OSH institutes working and rowing on the same direction with just one sole objective, protection of workers. Because at that time, we saw many other interests around, and that was not good. And we, OSH Institute, we only have one interest, and that's very important. So coordination of OSH institutes is something to keep and to really enhance. But apart from PPE, there was something else that demanded our attention, community face coverings. Honestly, a nightmare. The use of PPE, especially masks, went beyond workplaces. Everybody had to wear a mask in order to reduce transmission. And people started talking about masks and PPE in general for the first time in their life. But suddenly we saw so many experts around. And I don't know if you have experienced the same, but I have developed a huge mistrust on news after reading, watching, and hearing such an amount of disinformation. But it was the source of the population culture on PPE in general and masks in particular. And we read and saw so many people talking and saying what is and what is not a PPE, what is and what is not a surgical mask, and the same for CFC. I'm not going into it, you know it, but I'm pretty sure you agree that that was another element to increase the already existed confusion. We suddenly saw ourselves in the lab, dealing with new materials, different ways of manufacturing. We have to think about how to test, how to verify the performance of this new element. And also we have to think about special needs, as you see. We also started writing national technical specifications, trying to harmonize the way we were acting with this new element. And also in Europe, it was not easy, I tell you. But having said that, please don't misunderstand me. There are many reasons for me to support CFC. I use them. But more than that, I think we need to translate the prevention philosophy, risk assessment, and equipment selection to the general population. I heard once a specialist in prevention education and training say that we will have to succeed on it when prevention is so deeply inserted in our lives that we don't need to talk about it, because prevention will be part of our daily actions, as brushing our teeth 3 times a day. And last but not least, we have the equipment use in general and PPE in particular. We've been talking so far about the importance of designing and manufacturing, so in order to put safe PPE in the market. But we also have some legislation and rules for selection, use, and maintenance. And if we don't cover those 3 aspects correctly, all the effort we made before would be worthless. Nothing. Unfortunately, there is a lot to do in this aspect in general, not only for pandemic situations and private life, but also for workers, for workplaces where risk can present high levels and can be really dangerous. And finally, to wrap up my presentation, I would like to share with you some reflections about this special year. I think it's crucial that PEROSH Institute work to generate knowledge and experience on PPE, because we've seen how we coped with the situation because the knowledge we had. There will be more emergency situations. Everybody's saying that, and we have to be prepared for that. So it's very important, research, technical studies, and really generate this knowledge and acquire the experience. We've been all aware of the gaps in certain parts of our solid bridge. So it's nice to say that we have a wonderful blue bridge, but please get out of this comfort zone and work to improve those gaps that we all have seen, and somehow added more trembling to our bridge. And again, information, education, and training for the correct use of PPE, selection and use, is a pending issue. But please, we cannot continue saying that this is something to be improved, because I've been hearing it for 30 years now. It's time to solve the problem. But on top of all of this, I would like to highlight the outstanding behavior of the Institute people during this new, awkward, different, unprecedented, and never seen before year. The effort they did, honestly, went above and beyond their duties. We all have lived through something unusual and unknown. Our lives have been affected in very different ways. We have different experiences with our relatives. Some of us have welcomed new members into our families, and some of us have to say goodbye to loved ones. We have supported our families and relatives through these experiences and difficulties, and many, many other situations I have no time to mention. But despite it, no one left their duties and responsibilities to support better working conditions and protection of workers and every single one who needed it. I do really believe in PPE. I do really believe we need them, unfortunately, in many situations, and we have to use them and to have good products. And I'm not saying this because I'm telling today all this story about the PPE. I have a proof. I believe in that since I was 5. I was really convinced I have to wear PPE. I have to use them. But the color of my knees tells you that I have chosen the wrong one. So please, let's work together so to guarantee that we don't get more pictures like this one. Thank you very much for your attention, and I wish you a fruitful conference.
Thank you very much, Pilar. It's really amazing how the National Center has handled the situation and has responded to such a request. Well, we don't have much time left, but if anyone has any question, you can raise your hand.
Hello, I'm Marc Malenfer from INRS. Thank you for your presentation. I just have a little question. Can you give us an idea of the number of the samples who were not conform when you make all the tests? And yes.
Yes. We have to say that around between 70% and 80%, depending of, conform with what, no? About 70-80% was okay, and we have this 20-30% that was completely rejected, because you know that it depends, no? Sometimes it was not really the equivalent to an FFP3, but could be P2, and so, but around those numbers. And something that it was also important in those is that every time we were testing a model of PPE, we were also testing different batches. And we saw that the production control we have in our European system for category 3 PPE is very important. It's very important because sometimes we saw that the production was not uniform. So, testing and testing different batches from the same model. That was tiring and boring.
Yeah, Pilar, thank you very much for your very brilliant overview of the last 1.5 years and PPE.
We cannot hear very well, sorry, Peter.
Hello?
Yes. No?
Martin Liedtke, you know very well, and myself, we plan a side event to the A+A Congress in October, exactly dealing with this problem to be better prepared for a future crisis and to have a better cooperation between all players. Did you also reflect in Spain to have a such task force or expert group to be prepared for the next time in a better way, maybe?
I don't know if it's exactly what you have in Germany. The only thing that has been, as far as I know, in Spain have been done is that the Ministry of Industry has promoted the creation of a cluster on PPE, where you have the different stakeholders involved. Because in all the problems we have to face, it was very important the personal responsibility and honesty of the different stakeholders and all stakeholders. So we thought that it is very important to sit down all stakeholders around the table, so for all of us to have a clear picture of what is needed in order to really guarantee the protection of users, in general, users of PPEs. So this is the only thing that we have at this moment, and it haven't started yet, but they are proposing it. Thank you.
Does anyone else have a question? Okay.
Thank you. Is it on? Yeah, okay. Thank you very much, Pilar. A very emotional presentation of your experiences. And these match the experiences we had in the PEROSH COVID-19 coordination platform. We had a digital collaboration during the pandemic on exactly the sort of questions that you raised. And I would suggest that perhaps during a coffee break or what else, we discuss the further continuation perhaps of this platform in some sort of way, to keep on exchanging these experiences and to learn a lot from one another.
Yes, sure. I think it would be great, and I think we definitely have to be prepared, because this time we have the hospitals, we have this health sector, and we have biological risk, and we have to use mainly respiratory protection. I think that we all more or less were prepared. We knew the sector, we need the PPE, we have labs prepared for testing, though, but maybe if the emergency arises in a different area, we may be not prepared for that. So I think it's important to work on that beforehand. So of course, I will be really happy to talk to you.
Since we are really short of time, we have to end the question period. So thank you for your participation, and thank you, Pilar, for responding all the questions.
Thank you for listening to me and take that picture of.
Well, now let's take a short break for coffee and tea. At 11 o'clock, the following parallel sessions will take place. Pandemic and post-pandemic challenges, session A, that will be held in this room. Building bridges across OSH boundaries, session B, that will take place upstairs at the exit of this room. And all problems waiting for innovative solutions, session C, that will be conducted in the room that is next to the coffee place. I hope you find these sessions very interesting, and please, to get to the coffee place, follow the instructions provided by our conference assistants. Thank you.